Do you know the three issues scar tissue from cesarean birth can cause? Join me in this episode to learn more about my take on healing scar tissue from cesarean birth.
Hello, friends. This is Lynn Schulte, and you are listening to the Birth Healing Summit podcast. We are here for meaningful conversations that will transform the way you work with pregnant and postpartum clients. Whether it is a new perspective, tool, or technique, you'll be able to implement it into your practice today. I invite you to sit back, listen with an open mind, and grab the golden nugget today's guest has to offer. Now let's get started.
Hello, everybody. Welcome to this episode. Today, I'd like to talk about C-section scar tissue and what we as body workers can do to help our clients with this recovery from surgery. Three things that I want, you might already know, but I just want to reiterate, is there are three things that scar tissue can form in the body. And sometimes it happens right away, and other times it takes 10 to 15 years for these symptoms to start in the body. And by that time, nobody's thinking about the C-section scar tissue. And so we need to help educate our clients to be massaging their C-section scar as soon as the tissue is well healed. And that, can be anywhere from a couple of weeks to if they get an infection, it can be longer. So I like when the scar looks and is well healed and on the outside. We want to wait for the deeper tissues to heal as well. So I don't like doing any rigorous scar tissue. We can start with skin rolling and working the skin layer as soon as that is healed. But getting down into the deeper layers, I wouldn't do for a first couple of weeks. Like, let's wait till 3 weeks and then we can dive into it. Sometimes people come out of surgery and they have pain right away, and there can be some pulling pain that we can do some work around the scar tissue to help soften and give a little bit more mobility to the tissues surrounding the wound as it is healing. So that's something that we can do. And I just like really I learned the circles and the, mobilizations here at left, right, up and down. But sometimes I just like putting my hands on the tissues with their knees bent up and just kind of cupping in on either side of the iliac crest or the ASIS, from ASIS to pubic bone, and lower abdominal fascial release is what I teach in my courses. And I just like to sink my hands in on either side and see if I can sink down to the same level evenly side to side. And then just do a gentle, gentle scoop to the midline. Don't like creating any pain, especially if that tissue is not well healed. We want to be extremely gentle and work around the tissues if someone's complaining of pain or pulling or any discomfort right away. And then we can work on the scar tissue when the skin looks well healed. And then I would wait till about 3 weeks before, or, even 3 to 6 weeks before I get down in and start working the deeper layers. When I'm massaging the C-section scar, I know there's actually probably 8 different layers to the abdominal wall. But when I'm thinking about C-section scar mobilization, I like to just think of it in 3 different layers: the skin, the muscle, and then the organ layer. And it's really important for us as body workers to make sure that we get down to that organ layer and be able to move that uterus side to side. Then it's also important to move the uterus off the bladder and take the bladder one direction, the uterus the other direction, to help release any scar tissue that may be forming between those two structures. The 3 issues that scar tissue can cause with C-section scar healing is, one is bladder frequency. The uterus sits on, ideally, if it's in a normal position, the fundus of the uterus lays on top of the bladder. And underneath where the uterus and the bladder meet is where they have cut in to get the baby out. And so as that just lays there and creates scar tissue, that scar tissue can inhibit the bladder's ability to expand. We know that there are stretch receptors inside that bladder wall. And if the bladder is being stretched or pulled by the scar tissue, that's going to send the same signal up to the brain saying, oh, I got to pee. And we can get in there and free up that connection between the bladder and the uterus and release that scar tissue so that the bladder can expand fully without sending a signal to the brain that it is full. And what I love about this work is you can help someone in one session by just releasing that scar tissue. I do want to talk about when the scar tissue is too painful for you to do anything about, so stay tuned for that. But the second issue is deep thrusting pain with intercourse. Again, the uterus is being attached to the bladder, and for intercourse to be comfortable, the entire vaginal structures and the cervix is at the top of that end of that vaginal canal. All those structures need to be able to move during thrusting. And if the uterus is adhered to the bladder or any other parts of the structures nearby, because scar tissue forms very haphazardly as it's trying to heal an area, um, that any restriction of that uterus to be able to lift upwards with thrusting is going to create that deep thrusting pain. So getting in there and releasing that scar tissue can be super helpful in avoiding deep thrusting pain with intercourse. And then, of course, the third issue is low back pain. The uterosacral ligament, I have never met a C-section scar that is not tighter on one side than the other. And that's usually the side the surgeon stood on. They anchor, they sew across, and they come back and they anchor again. So there's a tighter side and a looser side to most C-section scars. And the tighter side can cause more restriction, more adhesion, and the uterus then is getting pulled back on that side. And because of the uterosacral ligament connection to the sacrum, that pulling back, that tightness will inhibit that sacrum from being able to flex and extend as it needs to with bending and straightening of the spine. And that can create back pain. And so getting in there and freeing that up and getting good mobility at that deeper level, we need to be releasing the uterus, even the uterosacral ligament, with vaginal tissue, with C-section scar tissue. That is what's so important for low back pain. So when I am addressing, so those are the three areas that moms mostly complain about and how we can address it all from C-section scar tissue mobilization. And when I'm working with someone who's had a cesarean birth, I want to do the external work and get that freed up. And then I also want to go internally, because what I have found, and was shocked when I first discovered this, is that C-section scar tissue can create pelvic floor muscle tension. You're like, how can that be tender if the baby didn't come out that way? But as the way I look at it, it's like, well, it's the two ends of the tube. And as we are pulling up and pulling baby out of the top part of the vaginal canal, it's going to put tension, transverse tension through that tube, and the pelvic floor muscles are at the bottom of that tube. And it's very important that we work with both the abdominal or the anterior vaginal wall and cervical mobility internally, along with releasing the pelvic floor muscles. A lot of times when you release the anterior vaginal wall, the pubovesical fascia, the endopelvic fascia, I call it the bladder. The anterior wall, behind that anterior wall is the bladder. So we need to make sure that that bladder has good mobility and that that cervix has good mobility in there. Those two things alone may totally change the tension in the pelvic floor muscles. So please make sure that you do both when you are helping someone who's had a C-section scar, a C-section delivery. The other thing I want you to just keep in mind is that when someone has had a cesarean, most likely the emergency cesareans, the unplanned cesareans, those can be very traumatizing to the body. And when there is trauma in the scar tissue, the tissue can be painful. It's painful to the touch, or there's an avoidance factor. The person doesn't want to touch their C-section scar. And both of those things, if it's really the scar tissue is really tender and painful, to me, there's stuck emotion in there. There's stuck trauma in those tissues. And if someone doesn't want to touch it, that's a trauma response in their body, disconnecting them from the experience. And so they need healing around what actually happened to them. And sometimes it happens so quickly. And there's such fear around an emergency C-section that the baby's going to die, the baby's not going to make it. And that creates a huge stress response in the nervous system. And we need to address it both in the nervous system and in the tissues. And I had a client that came to see me who 5 years after her cesarean birth, she immediately had pain in her C-section scar. And in those 5 years, the doctors were trying to figure out what created all that pain. She went on and had two more exploratory surgeries in that same area. And when I went to put my hands on the tissue, it was just like there was so much trauma in that tissue. And I helped her to replay what had actually happened during that birth. And the pain just went away. And she was in awe that for 5 years she's had this pain and it actually was just trauma. And there was nothing actually wrong with her tissues. And we need to understand that there's not a lot of knowledge of how trauma impacts the body in the medical system. And we can feel into that. You can learn to feel into the quality of the tissue. It's getting beyond whether the tissue has tone or is restricted, but actually sensing into what do I feel in these tissues? What do I sense about these tissues? What about the area underneath these tissues? And getting clearer on feeling for that trauma in the tissues. And so I just invite you to increase your awareness, expand your awareness about C-section scar tissue and feeling for beyond the mobility, the physical, get into the energetic, get into the sense of, is there trauma being held in these tissues? And learn how to address that so that your clients can get out of pain pretty easily when you address it in that way. So please keep all of this in mind as you are working with anyone who's had a cesarean birth. And also a labored cesarean, we also need to keep in mind the impact that that may have had on the pelvic bones, in particularly the sacrum. I always like to ask my moms who had a labored C-section, did the surgeon have a hard time getting baby out of your pelvis? And if that is a yes, then I know that that pelvic inlet has gotten it has the baby got into the inlet. So there is some changes to the pelvic inlet. So I may find that sacrum stuck in more extension and will have decreased mobility at S1 and S2. And as you increase mobility there, then the pain can go away. I had a mama that came to see me and she was in so much back pain for so long, been seeing all these chiropractors and massage therapists. And when she stood, her shoulders were actually like lifted up. Her shoulders were weight bearing for her, or trying to. And she had a very flat lumbar curve. There was hardly any in standing. And when I laid her down, the lumbar spine was like almost flat. And so I mobilized S1 and 2, and there was no mobility. And 3 and 4 had mobility. And so I got more mobility in S1 and 2, and she stood, and then we got more of a curve. The lumbar spine, the lumbosacral junction had a completely different angle to it. And she stood up and she's like, oh my gosh, I am so much better. She still had a something going on with either a disc or a facet or something because she was shifted. Her thoracic or her lumbar, her trunk was shifted over her pelvis. So there was some other dysfunction going on in her body, but the overall pain and the ability, like her shoulders just relaxed, her whole body relaxed because now the pelvis was able to support her weight through that area better and it wasn't stuck in extension anymore. So please keep this in mind as you're working with your postpartum clients. Really pay attention to, what did the pelvis go through? What did the body experience during this birth? And see if you can start to feel for that in the body. Okay. I hope this was helpful. Please keep supporting our mamas, especially those that have had cesarean births, and really important for those mamas that would like to have a VBAC, that we get them back in and we really assess to see what might have inhibited baby from being able to be born in that first. I also like to ask my moms that have had C-section, did the doctor see anything? Like, was the baby in a weird position, or was the cord really short, or, try to get a sense of what was actually happening. I'm not sure most doctors are looking for that when they're doing a cesarean surgery, but that would be nice and helpful for our moms that would like to then have a VBAC, to have any information that might have prevented a vaginal birth in the first place. But we know as practitioners that looking at the pelvic floor muscles and the pelvic bones and their ability to have mobility, making sure baby gets into the best position possible to come on out, are all things that we can support our mamas to have a VBAC in the next time around. Okay. Thanks everybody for listening in, and we will see you all in the next episode. Here are to smoother births and faster recoveries. Take care, everybody. Bye-bye.
Today's podcast was brought to you by the Institute for Birth Healing. To discover more, visit instituteforbirthhealing.com. To claim $50 off of any online course, use coupon code PODCAST50 at checkout. Till next time, I'm Lynn Schulte, founder of the Institute for Birth Healing.